going to talk to you about the history of nerve surgery for treating diabetic neuropathy. Now, I want to kind of sort this out because it doesn't cure neuropathy. What it does is treat one component of diabetic neuropathy, and it's also a component of chemotherapy-related neuropathy. It's also a component of hypothyroid-related neuropathy. It's also a component, very commonly, of idiopathic peripheral neuropathy. I mean, you have to be careful and get it the right patient. But back in the 80s, there was early recognition by hand surgeons that patients that had diabetes in particular had a much higher frequency of carpal tunnel syndrome than the average population. So they were doing carpal tunnel surgeries on patients with diabetes, and they noticed that all of their numbness would go away. They would feel substantially better. If you've ever talked to anyone who's had carpal tunnel syndrome. Now, keep in mind, not everybody that has carpal tunnel surgery is successful because sometimes they've waited too long, or maybe they were misdiagnosed. But in general, it's a very highly successful surgery. And so what happens in 1992, there was this gentleman named A. Lee Dellon, who was a doctor that I actually studied under, who started doing experiments. And he did carpal tunnel surgery on rats, and he noticed that rats walked better. And then he did carpal tunnel surgery on monkeys that had diabetes and noticed that they got better. So then he started doing it on people, and he noticed that, hey, you know, these people are getting better as well. So he published quite a few articles about this concept of nerve decompression for diabetic neuropathy, and he was the first one to really formalize it in medical literature. Now, he went through, I guess you'd say, a lot of ridicule by the traditional medical community. It was odd that patients with carpal tunnel surgery would undergo surgery and they would get better, and then he said, well, let's just do it on the feet too, because it's the same procedure. And then, for some reason, this was okay, but this was terrible. But anyway, so he started doing it on feet, and then they started clinical trials back in the early 2000s. Then they expanded research from 2000 to 2010, and basically they started having controlled trials in the last 10 years, the last 15 years. Now there's actually some blinded studies, which is kind of weird. This is what a blinded study means. They'll actually do surgery on one side, and the other side they'll just make an incision and sew it up and trick the patient and say, well, did you get it done? And then they evaluate the patients. And this is, so now if I said to you, well, if you had 100 patients that got better with this surgery, would that be substantial for you? Would that be convincing to you if you were a candidate for that surgery? Well, yeah, maybe. Okay, so let's say you had 200 patients that went through this surgery. Would that be convincing to you? And they said, I feel like 90% of them got better. Would that be convincing that maybe, okay, this is something I should consider? Maybe. Well, let's say it's 4,000. If you had 4,000 patients that went through this surgery that were critically evaluated by medical literature, would that be enough evidence to make you think, okay, if I'm a candidate for this, this is something I should do? Now, this obviously doesn't apply to all patients, but these are two what they call meta-analysis reviews. What meta-analysis reviews are, they take many articles and they compile them. They look at the evidence and they evaluate how the patients did. So between these two studies, somewhere in the neighborhood of 4,000 people had significantly improved pain reduction and symptoms and better nerve conduction studies. So the evidence is kind of clearly overwhelming that this procedure is pretty effective for patients that have certain types of diabetic neuropathy. But what I like to call it, instead of just diabetic neuropathy, I call it nerve compression contributed to by diabetic neuropathy, because nowadays how we actually can evaluate your nerves is look at them with an ultrasound. If your ultrasound shows your nerve is enlarged, or if it's large above the nerve entrapment site and small under the nerve entrapment site, we see that all the time, then you could probably get relief if you have some other signs by having that nerve decompressed. Because all it is that you've got a nerve that gets enlarged from whatever metabolic disease it is going through a tight tunnel. And the surgical procedure is you're just taking the tunnel off the nerve so it can breathe. I'm sure you've had the experience, I'm going to jump 2 slides ahead here, of waking up in the morning and your arm's numb or your hand's numb. And as soon as you get off your arm in an odd way, you start to feel your hand getting warm and the tingling goes away. It's a very comfortable feeling when that nerve starts getting blood flow in it again. Well, that's the same thing we're doing with the surgery. It's just, that's exactly what we're doing. So basically, there's nerve entrapment sites in the foot. So like this is somebody's heel bone. There's nerve entrapment sites in the foot or in the leg or in other places that you can get pressure off these diseased nerves and they feel better and they function better. So the question then becomes, should surgery be a last resort, I have this up here, or a first-line treatment? Because nerve surgery is the only surgery that we do where time is a consideration. The longer you wait, the worse the outcome, no matter what happens, because nerves have enemies. One of them is time. If you compress a nerve for a long period of time, it's very difficult for that nerve to recover. If you compress it for a short period of time, it's much easier for that nerve to recover. So sometimes we'll do this nerve surgery before, and then we do all the subsequent things afterwards if we need to. But these are things that we can provide you here at the Next Step Foot and Ankle that are kind of unique to Next Step Foot and Ankle Clinic, because our doctors are all trained in nerve surgery. I myself am a fellow of the Association of Extremity Nerve Surgeons. I've done thousands of these types of procedures. And so we also have all the tools to provide all those other modalities. We actually have other modalities that I didn't talk about here today that we can treat you for neuropathy. So if you have neuropathy, I consider our clinic to be the place to go. So especially, I mean, in the lower extremity, of course. So give us a call at Next Step Foot and Ankle Clinic. If you are suffering from neuropathy, you don't have to. Thank you.